So we are going to talk about deficiencies. Now that is something which I see in most of my patients when we get their reports. So yeah, either they are deficient in B12 or calcium. When we do their body composition, we see that their protein level in the body is also quite less. And because of that, क्या होगा? Hair loss हो जाएगा. There'll be fatigue. There'll be chronic fatigue. There'll be shortness of breath, a low mood, anxiety, depression, bloating, water retention, so many things which comes along with the deficiencies in the body. Now ये mineral deficiency होगी, protein deficiency होगी, iron deficiency होगी. They are basically, why is this happening? When you're eating nutritious food, you're trying to eat all the possible foods, good foods which are available. So why does that happen? That usually happens because of, yes, low stomach acid. Now, when we talk about low stomach acid, that is आपके stomach में, okay, when you eat food, it comes down to your stomach, and here it is getting grinded, it is getting churned, so that it can further go for digestion. Now, HCl is something we need in the stomach, so that which the stomach produces, which helps in grinding and churning of the food, breaking down of protein, absorption of nutrient, and also protects you from so much of overgrowth of virus and bacteria. Now, when there is low stomach acid, what will happen now here? The food is undigested. It is undigested, it is getting fermented, and that's how we get Sibo, which is a bacterial overgrowth, H. pylori or ulcers. Now, usually, why people ask me, why is my stomach acid low? Could be several reasons, okay? If you are taking too much of alcohol, you're smoking, vaping, or you are having a lot of hookah, you're eating processed junk food. Now, when I'm talking about processed junk food, I keep emphasizing that it's not just the burgers and pizzas, okay? It's also the healthy food what you're ordering from outside, because it does have preservative, flavoring agents, also things like dips. Okay, people think, oh, I'm eating this hummus, or I'm eating this particular dip, which is very healthy. But if you're doing a ready-made market-based things which have a lot of preservatives, it's also counted as a processed food. So ketchups or any of these dips what you're having. If you've been on medication for anything like a chronic disease like cancer or any other stomach infection, so all these things, even antacids, that is something which people ignore. So whether they're having Eno, Digene, or they're having this antacid like Pan 40 and all, that is something which we don't even understand, and we just pop in, kecha khana digest nahi hua. But all these things over a period of time affect your stomach acid. Now, what do you need to do here? You definitely need to correct your diet. So you need to eat good nutritious diet. That is one thing. But along with that we customize as per our patient, depending on what exactly or what symptoms are they showing in. So now what you have to do, you have to eat in a calm state of mind. Now, when I'm talking about calm state of mind is when you just sit down, wash your hands, do deep breathing, pray, have a gratitude for the food what you've got, look at the food, appreciate what you've got, appreciate the person who's cooked that food for you, okay? Be thankful of whatever you're eating, and slowly chew your food and eat it is the time when your body is going to digest that food well. Now, what happens in most of the time, we are either switching on our television, or we're on the call, or we're in hurry कि हमने office पहुंचना है या एक और meeting में जाना है. So we're just gulping down the food. So you have to eat in that calm state of mind, because that is something you really deserve to do. Okay, एक 10 मिनट अपने आप को देना और आराम से खाना खाना is something which is very important, and you deserve that because you've really worked hard for that, right? So eat in that calm state of mind, chew your food well. Now, chewing and not gulping down is something again which you need to work. Why? Because when we're in hurry, we end up just gulping down, or when we're in a conversation with a friend, or while we are eating or say a company meal. So we are just talking with people and we're just gulping down without realizing what we are eating. In that whole bargain, the brain doesn't register, or it doesn't understand what to release, what kind of digestive enzymes, bile or insulin or acid to be released, or how much quantity. So it's very important for you to eat in that calm state of mind without any gadgets, and chew your food well for food to get digested. Okay, so that is something which we all have to work, because in our busy lifestyles we somewhere miss doing that, right? Now, gap between meals. Say for example, you've had your breakfast at 9:30. You are not supposed to eat anything before 3 hours. राइट. सो नथिंग, सिर्फ अगर 8 बजे खाना खाया तो आप 11 बजे ही एक मिड मील खाओगे. Now after mid meal, at least a gap of 2 hours or 2.5 hours for your major meal, that is your lunch. But if you're going to eat frequently every hour, your body, your stomach is not getting sufficient time to digest that food, and before the previous food is digested, एक और खाना आ गया. So it doesn't know what to do it just pushes the undigested food, and hence the growth of Sibo and H. pylori. So stay active. Stay active, especially for all those people who are in office or in IT sector and they are sitting for a very long time. Please get up every hour, and especially post meal. Now post meal आपने कम से कम भी गिन के 1000 स्टेप जरूर चलना. Just stay active. Go keep your plate back. Just rinse your plate. Just keep winding up the dining table or do something. Stay active. Don't sit down immediately after your meals. You need to stay active throughout the day, but especially post meals is something which you have to take care. Okay. Then is you have to see that you include or increase the soluble fiber in your diet, and that is most easily included is through variety of vegetables. Okay. So people who already have gaseous or flatulence or undigested feeling कि मेरा खाना digest नहीं हो रहा, avoid raw vegetables. Okay. You have to do assorted vegetables. So at least 3 to 4 servings of vegetable is something which is very important. Include that in your diet. Then avoid doing any crash diets. Please take this as a warning. Your system can't take elimination of food groups. Say for example, you're not eating carbohydrate and you're doing just a protein, you're not eating fiber, your body will not be able to break down that food. So don't eliminate any food group, which is again going to affect your stomach acid. And use of certain foods, which is very simple food, they have antibacterial, antiviral, they help you in digestion of food. So say for example, using ginger water, that can improve the production of the low stomach acid in your body. It can say lemon water is another simple remedy which you can have maybe post the meal or before the meal. That is also which is going to help you. You could also use things like ajwain. Ajwain सबको पता है ना, एक digestive फूड है. अगर पेट खराब होता है या बहुत ज़्यादा गैसेस लग रहा होता है तो व्हाट डज योर दादी टेल यू, एक अजवाइन सीड्स ले लो विद लिटिल नमक. So ajwain is something which is very good. Mint is very good. Sauf is very good. So using of such foods are also going to help you maintaining your stomach acids. Now, usually when we have to do for our patients, we may have to eliminate certain food like maybe lactose or dairy, or we have to eliminate wheat depending on what is the state of their gut. Okay. So now you know that if you feel bloated and you feel कि मेरा energy levels drop हो रहे हैं या deficiencies बार बार हो रही हैं या gaseous हो जाता है, या I'm getting anxiety, my food is not getting digested or pushed down, I'm just feeling so bloated, is because of the low stomach acid. And how can you correct it? I've given you certain ways. Understand the reasons why are you having low stomach acids. That's what we do with our patients when they come to us. When they give us the symptoms, we figure out with them that what kind of symptoms are they showing, and sometimes we have to eliminate certain foods for certain time, and that helps them further. So if you have any questions on stomach acid, or you're feeling that you're not able to digest the food well, or you're feeling that you have constant deficiencies, feel free to put in the questions and I'll be happy to address them.